everyone, welcome back to RPIIT Academics. In this video, we are going to learn about handling of the blood sample. So sample should be placed in a sample rack. Then transport the sample to processing area should have ice chamber. If open system of collection is used, then check for loose cap off while before transport. Then hazardous sample should be placed separately. Any viral positive sample should label as biohazard, which is very necessary for the prevention of any viral disease to other persons. Now there is a transportation of specimen. For transportation, separated serum and plasma specimen are transported in a container kept at 2 to 8 degrees Celsius. Whole blood specimen after collection should be immediately placed at 2 to 8 degrees Celsius. Transportation of specimen should be done in thermoflask at 2 to 8 degrees Celsius. Bilirubin specimen should be kept away from daylight to avoid photo degradation of bilirubin. Now there is a storage of blood sample. Whole blood can be stored for 24 hours at 4 to 8 degrees Celsius, which must not be frozen. Serum sample can store after the separation from the blood clot at 4 to 8 degrees Celsius for maximum 7 days. And frozen sample on the minus 20 degrees Celsius or lower, serum can use after the long period. Automated analyzers shows increased monocyte. If we store the whole blood for 24 hours, the automated analyzer will show the increased monocyte, and we store the serum sample for 7 days. Variation in biochemical parameters, glucose, enzyme, etc. may occur. And if after the frozen we test the antibodies, IgM stability is affected, avoid IgM antibody from frozen serum. Now there is a discarding of blood samples. So here is a red colored dustbin, or you can use poly bag in the red color. All blood contaminated plastic should be discarded in red bin. For example, vials, ABG, syringes, etc. Now this is the segregation of hospital biomedical waste. So you can see over here in the green basket, we will put general waste, kitchen waste, paper, tissues, water bottles and cans comes under in the general waste. And the infected plastic such as syringes, gloves, plastic waste will be go in the red basket. And then infected waste like soiled, anatomical, chemical, liquid, cytotoxic, laboratory waste, expired waste, discarded medicines and so on will be go to the yellow basket. And the glasswares like antibiotic vials, metallic implants, glassware, material, expect cytotoxic will go in the blue basket for recycling. And the sharp things like needle, cut glasses will go in the sharp pit, okay, in the red basket, which basically it will come in the transparent basket. So and then so here you can see over also the green basket will go for incineration, and after incineration the waste will be put in the secured landfilling, and in the red and the yellow will go for autoclaving and secured in landfilling and deep burial. So that was it for this video. If you like this video, then please do subscribe our channel. Thank you very much.